Treasurer's report. Thank you, Tori. The treasurer's report, we have $2,275 as a balance. And I have a couple of receipts to give you, Tori, but they're not urgent, so I'll just get them to you for the paper. And I need to either get sturdy envelopes to mail the certificates in, or certificate holders. And I haven't found regular envelopes that are the correct size for the certificate holder. So I may just get sturdy envelopes.
I have a question.
Yes.
Do this amount expires at the end of this fiscal year, which I guess is the end of this month? Is that correct?
I believe that's true.
So I'm just wondering if there are any relevant projects or things that we may choose to do before the end of this month.
It's a good wonder. Do you have any ideas?
No, I just had the idea to ask the question.
Good question. I didn't have any ideas either. I'm going to get a pen. That's why I'm disappearing for a sec. I can write your questions down, but I will get those receipts to you, Tori. So that would be maybe $100 or so. Okay. Think on it, Bob Cobb, and if you come up with something while we're moving along.
Okay, or if anyone else does, please, yeah. Consider it.
Yes. Okay, so we have a vacancy in District 2, which is Rabbit, and one in District 4, which is Gore, and one in District 5, which is Hopkins. And Peterson, did you find anything out about Annabelle?
No, no, I didn't. I tried, but I didn't get any answers.
Okay. Okay, so District 3, we have 3 people there, but we aren't clear about Annabelle's appointment. So Peterson's working on that.
Yeah, for sure. I didn't return my call when I left a message. But
okay, perfect. Okay, and we will be approving the minutes from May 18th and the at the meeting in June, and also the minutes from the retreat. And I believe you've received both of those. Special topic presentation. I got an email from Melissa Ledretch, and her requirements for submitting the for having the annual MHSA annual hearing that we host is that it has to be, the results from that meeting have to be submitted by July 20th. So that's our normal board meeting. And originally we had thought about having her annual meeting in August. That's not going to work. So she requested to have it July 13th, which is the Tuesday before the 20th. And without any without any strong objections, I think we should do that. I'm not available on the 13th, but Peterson could take over that meeting. So does that sound acceptable to you guys?
We're speaking of July 13th.
Yes. So the second part of that is that July is our normal West County meeting. So I asked the people who I would have asked to present in July, I asked if they could present in June, and they are willing to do that. So we will have, without any big protest from you guys, we'll have our June meeting be the West County meeting. So are there, anybody have objections to doing that? Okay, so
what your part of your question was, are we okay with postponing the July executive committee meeting, or are we talking about the mental health board meeting in July to the date of the 13th?
the mental health board meeting in July to the date of the 13th.
Okay, thank you.
And it will be the MHSA annual plan meeting.
Okay.
So mostly it will be Melissa that's, presenting, but I won't be able to be there. So Peterson will do the meeting. Did you have your hand up, Marianne?
I did, thank you. But you covered it just now. I was thinking, what a thing for Peterson for his first meeting to chair would be the Public Mental Health Services Act meeting. But you're right, the staff pretty much orchestrate all the presentations for that. So Peterson, it'll be a fun inauguration for you.
Yeah. And I think, it's mostly Melissa will be, she does most of that meeting. And
Yeah.
so it'll be an easy first one, Peterson. I think. Help him out if not. So June 2nd, or the June meeting, which I'm forgetting the date, it's the third Tuesday, so that would be the 15th. June 15th will be West County. So that brings us to
So if I understand it correctly, it will be the July meeting I'll be chairing, or the June meeting?
July.
July. Okay.
Okay, so normally we don't have an August meeting. So if we don't have the MHSA meeting in August, we have to decide if we are going to have an August meeting or not. We have plenty of presenters. There's no problem filling up those meeting spots, I don't think. So a couple of the things that I think are coming up that we will want to have presentations on are the jail presentation. There's two that are possibilities. The first one is Carol had contacted some people about presenting about jail reentry and reentry after incarceration. And so I don't think she's able to be here today, but she was surprised that that wasn't one of the upcoming meetings. So those people are ready to present. I think that you saw the information about FURS, FIRS, the foster support, and that's a possible one. I know that Bob and Mary Frances, Bob Hale and Mary Frances and Carol have been working on the other jail information, and the new facility is moving forward. And that's another possibility, is having another presentation on that. So all of those things can be presented September or later, or we can have an August meeting. Yes, Bob Cobb.
Maybe this would be an opportunity to consider adding to the mental health board meeting agenda a discussion on whether we philosophically or with whatever intention choose to have August and December off, no meetings as had been traditional up until the last couple of years due to external events that caused us to need to have those meetings. Do we want to change to a monthly meeting throughout the year, or retain the 2 months where we had not typically met during August or December? I think that's a question for the board as a whole.
Yes, I think it is too. So maybe we should just vote, put a vote on that at the regular meeting. Any other ideas?
Well, I guess, let's see here. Can you hear me?
Yes.
Yes.
Oh, good. Okay. It says mute on my little picture, so I'm never sure. I think in interest of preserving the very hardworking public employees, it would be nice if they didn't have to deal with some of the workload that our meetings, as well as the MHSA meeting, generate. And August and December, even though we're not in traditional times right now, I think people still have other responsibilities that they like to do. And so when we come to a vote, that my vote would be to keep that schedule of having August and December no meetings.
And we can make that decision as an executive committee to just not do August and December, because that has been traditional.
Well, I'm happy to decide now. We've got busy agenda the rest of the time, but others may want to have the rest of our group to weigh in. I don't know.
I feel like I also agree with Mary Ann. You hear me?
Yes.
Yes.
Okay. Sorry, my internet is really spotty, so I don't ever know.
I agree with Mary Ann too. So
I'm kind of, I've been supportive of the traditional schedule that we've had, but obviously seen the need for due to special circumstances, having meetings in August and December for the last couple of years. But I would just as soon go back to keeping those dates open unless there's something extreme going on that we need to attend to. But on the other hand, even though we may have the authority to make that decision, I would feel better having it voted on by the entire board, having their input.
Mhm.
Okay.
I agree with that.
My vote would be to not have a meeting in August as well, I believe. So that's a lot of us, but it would be easy enough to bring it to a vote. So go ahead and put it on the agenda, Tori. And yeah, I guess a vote would be the appropriate way to do it.
If I could
Yes.
kind of go the other way on it, do we actually need to take any action, or just assume that we're going to resume the traditional schedule of no August and December meetings and just not have anything scheduled for that, and maybe not need to take any action? That's another way to approach it, I guess.
Yeah, because the need really was the MHSA meetings, and if we're already scheduling it in, then the need isn't there. So
Let's
you
stick
know,
to the
resuming our
schedule.
previous schedule would
Mhm.
just work. Peterson, do you have an opinion on this?
No, I was just saying, since we have already accommodated the meeting, so we may as well just keep to the original schedule that we have had.
Okay, so that's
And there'll be no need for a vote. We just go back to our original schedule.
so
I-
so really here it's unanimous. So why don't we just do that? We'll go back to the original schedule, and we just won't have a meeting in August or December. And if somebody, you know, protests that, then we will have a discussion, but let's do that. No meeting in August. Okay.
So is that off the agenda now, or is
It
it
is
still
off
on?
the agenda.
Okay.
It will be announced, of course, but it's off the agenda.
Okay, thank you.
Okay. Okay, Bill.
Pretty much, we're working on all the things I've reported on the previous months, right? So we have some grants that we have, grant applications we've sponsored that are moving their way towards implementation. So that includes the early psychosis intervention funding from the OAC, and the mental health student services, also funded by the MHS OAC. So in one case, we're partnering with the Early Psychosis Collaborative of the Elizabeth Morgan Foundation, Aldea Buckaloo, and UC Davis. And then the case of the student grant, we're partnering with the Sonoma County Office of Education. We, in general, this is the height of our contract season, so we work to get as many contracts as we can completed and updated for the new fiscal year. So a lot of our time is focused in that area right now. And then we, continue to respond to the board's requests for information as they're developing the budget. And you'll see 2 June budget hearings related to Department of Health Services coming up this month.
Bill, does the board allow you to have multi-year contracts with selected agencies?
So so one of the reasons we are running behind is we have been directed because about 3 years ago, it was identified that too many long-term unrefreshed contracts was a problem, and so we were told to do them all yearly. That has caused us problems, and so we started last year to begin to move all contracts to a 3-year cycle, so that we're just dealing with 1/3 of them every year. So we're still in the midst of digging out from that problem, but it's getting better.
Okay, and you told us about the budget hearing, the previous budget hearing,
Mm-hmm.
and I'm wondering if you know the dates of those in case people would like to attend.
The 15th and the 22nd.
Okay, so one of them is the same day as our meeting. Okay. Any questions for Bill? Bob?
Bill, does the going to the 3-year staggered types of contracts, does that solve some of the issues of long-term contracts which were not being reviewed? Does that satisfy the concern?
Yeah, yes, it does. Yeah, I mean, for us, it's also a workload issue, which is we just have not been able to keep up with the volume of contracts, contract renewals, and contract amendments. So that if you remember the last couple of years, that's been very difficult for CBOs who have gone into the new fiscal year without a contract. So we're looking to reduce that quite a bit this year, that delay. And one of the primary strategies is to move to 3-year contracts, which we started last year. So we've reduced the volume a little bit for this year, and by next year we should be on a better cycle that way.
Bill, how's
did
the
that-
puff going?
Go ahead, Bob.
Bill, how's the puff proceeding?
It keeps getting pushed back little bits and bites, which is frustrating to people. So it's now looking like it'll get through all of its rebuild and licensing by the end of September. So looking for them to begin admitting clients in October.
So on the budgeting, the 3-year budgeting. So I'm wondering about the peer centers. Does the county contract for them, like with West County? And is there any protection in having that 3-year contract?
Not much, because the contracts are designed such that we can close them out if there's not enough funding to keep the work going, which is pretty standard. The state does that with us as well. All of our contracts with them that are our funding contracts talk about that.
Do they appear to be safe though?
Yeah, I mean, I can't talk about it. I'm not worried this year. And, you know, as I've said, it's a high priority on everybody's part to do something with the budget that enables us not to go through this process we've gone through every year of having to scrape up next year's funding. So again, because it's not my budget, can't talk about it, but I can let you know that's a priority, and I can let you know I'm not worried right now.
Okay. Bob Cobb?
Going back to the puff, Bill, is there some sense at this point that referrals to the beds there would be reserved for the agencies that are funding, that are collaborating to put this into effect?
Yeah, just the 2. So it's just us and Marin County. So the 16 beds, 2 are on contract with Marin, and 14 are on contract with Sonoma.
Okay. As far as the on contract, does that mean referrals directly from crisis stabilization unit or medical centers within Sonoma County, or how is that defined?
So our preference is going to be that the referrals come through the CSU, right? So we want to, as much as we can, operate a system that provides the best treatment and gives us the best options for offering services. And that happens when someone comes to the CSU and they have an opportunity to stabilize in 24 hours. However, so that's going to be our primary goal is for the flow to move in that way. But you know, it's also the case that if the CSU continues to have the bottlenecks it has, We will work on processes that allow, for example, the emergency departments to receive authorization from us to make a referral to the PUF. And we'll have to work out the details of that. We have not looked at that yet. We'd have to figure out how to get a packet. PUFs need to review people. They're not open like emergency rooms, just come in and we figure it out. They need a packet. They need to know what's going on ahead of time. So we'll have to figure that out. But the goal is for the PUF to alleviate anybody boarding in a CSU or a hospital emergency room.
Thank you.
Bob Hales?
So Bill, the CSU then will serve the purpose as the entry point, regardless of whether originally in a PUF or ER in a general hospital.
Mm-hmm. Yeah. We want to get folks, if they're in psychiatric crisis, we want to get them to the CSU as quickly as possible. And then the goal there is to stabilize them and send them home with a strong follow-up plan. That's the ideal scenario. And then when somebody cannot stabilize in 24 hours, we want them to transfer quickly to the PUF. And, a couple of things, a couple of characteristics to keep in mind. One is just the volume of beds is going to make a difference. So if you think about it, we're going to go from a 16-bed CSU in our crisis continuum to a 30-bed CSU and PUF crisis continuum. And then the other thing that's going to happen is, because all of these beds are on contract with us, we're not going to have so much trouble making referrals. Right now, the hospitals cherry pick, right? Because it's a buyer's market or seller's market. I can't remember which way the market's going. Anyways, they get to decide, they get to pick the patient that is going to be easiest for them, right? So it's not unusual for them to delay an admission because they're waiting for somebody better to come along, or deny an admission because they've got plenty of people on a waiting list. So Crestwood will be our partner, right? We'll be working together. We won't have to sell our clients to them. They understand that they are in our system like the CSU. They are designed to take Sonoma County clients. So those are the dynamics that we are betting on to make improvements. It's also the case that they know, because we have a CSU, people can fall back, right? So that if they got somebody, did not work out, they know we can use the CSU and the PUF continuum to try to manage people who don't quite fit the system as well.
Bill, since the CSU will be having additional function, it's kind of a gatekeeper. Are they staffed up to handle that additional workload? Or is that?
Right now, we're not staffed up to run at 16 beds regularly. So we, last year agreed to move from 12 beds to 16, and we've got the allocations and we've got the budget. What we don't have is a workforce right now. So because of COVID in particular, there's already a nursing shortage pre-COVID. So it's very difficult to get nursing staff. And then that's made worse by COVID, where nurses are in high demand and have plenty of choices about where they can go and what they can be paid. So we've vacillated. So we run now from 12 to 16, depending on what's going on with staffing and acuity. But the other thing is, I'm hoping that moving into this new fiscal year, we're going to be able to staff up in a more stable manner.
Hey, any other questions for Bill?
I do have one.
And then Peterson.
And just to follow up, wasn't the CSU capable at one point to serve TAY clients, a small portion of them?
They still are.
Oh, okay.
Transition age youth. So the limitation occurs when our census is such that we have to close our adolescent unit. So when our adult census gets too high and we have to use the section of the CSU we have set aside for adolescents, as soon as we have to move one adult in there, we have to stop taking adolescents because you can't mix the two. So transition age youth, if they're over 18, they've got pretty unfettered access to the CSU. If they're under 18, their access is limited when we are limited regarding our adolescent slots.
Thanks.
Peterson, you had a question?
Yes, I do. My question is, how do we handle people who are from out of county within the CSU system?
So people usually, I'm assuming you're talking about folks who are Medi-Cal, is usually
Yes,
when
the
we're,
folks who are medical, but they have like, say, Mendocino County Medical.
yeah. So we contact Mendocino County and work with them to determine what's happening. So usually we're getting a hold of them, and if someone is not stabilizing, we're working with Mendocino to get authorization from them to transfer someone to a hospital.
How smooth does that process go, knowing there's such delay in everything?
It depends, you know, particularly the smaller counties like Mendocino don't have, they just don't have as many resources. So trying to get a hold of them. So for example, if somebody is admitted on a weekend, we frequently can't get a hold of anybody until business hours on Monday. So there's some trouble there. There's also the scuttlebutt. So the grapevine is that some counties are telling people that Sonoma County's system is better, so they should go here when they're in crisis. So there's some concern on the part of our staff, for example, that people from Lake County arrange to be here so that they move into our CSU. So those are complicated cases, but it's not a giant problem for us. It's not right now. I'd say staffing is a big problem, and then people high levels of acuity. And we've gone through a stretch. Things seem to go up and down. We've gone through a stretch of people who are in psychiatric crisis and have medical limitations. So we've had a lot of people, for example, with incontinence and caprices and psychiatric crisis. And so they're a difficult population for us to handle because we're not a medical facility with all of the housekeeping and, you know, cleaning resources that are available to a hospital. So that's been a big problem for us recently. And then people who are aggressive, right? So we always struggle with, is somebody too aggressive for us or not? And where do they go if we find they're too aggressive?
Yeah, what is considered too aggressive?
The way so it's, you know, it's always a judgment call, and it's always on a case-by-case basis. Anybody who requires regular physical management is probably too aggressive for us. So we are in a position where we can do physical restraints and take someone down, and they can be put in mechanical restraints, and they can be medicated, sedated during acts of violence that meet certain criteria. But if somebody requires that regularly, then we have to ask, are they beyond our capabilities? Because our facility is not hard enough, right? We're not a jail. So, for example, one day when I came into the unit, staff were on one side of the double doors holding it while a young man threw his body against the door, and you could see the wall and the frame moving, right? You could see that if this continued, he would push the door frame out of the wall. And then we're not staffed like a jail, right? So we just don't have as many large, strong, trained people as a jail does to physically manage somebody frequently.
Okay. Any other questions for Bill at this point?
I have a question.
Yes.
Okay. So I'm always wondering and hoping that we can work on enhancing family engagement, and awareness and education. I feel that, for example, some of our families who don't understand mental health as much, or maybe who have, a lot of stigma around mental health, and so they're very new to mental health. Um, to provide some in-house support, some home visits. I know that's really difficult, but I wonder if in our attempt to break the stigma and to build more awareness in our communities, offering that sort of, and I guess it's a little bit more aggressive on the side of the county, or maybe that's beyond capacity, but I do think that that is an area for growth for us, and I'm still at a loss on how to go about that, but I do know that there's lots of families out there who are doing the work on their own and feeling isolated and also hopeless about what they're doing in home because of just the lack of awareness. So just wanted to bring that up, not necessarily wanting an answer, but maybe you do.
Yeah, well, so we should be able to do that if for people who are our clients who we are working with to engage. So we should be, we have what we need to work with the family, and we should be doing that. I think that when we, right now, an obstacle is our caseloads are far too high across all of our programs. And so too much of our time is spent right now responding to crises, and not enough time is spent on, thoughtful mental health intervention, designed to support long-term recovery. So the first priority for us right now is to figure this problem out and get caseloads down to where people can spend more time with them. But I know that work is happening. Whether it's happening enough or not, I don't know. And I know that because I hear the phone calls, I hear our staff talking to families and advising them. I know that I've also dealt with some cases where people are just frustrated, and I join them in that frustration. I don't think there's many things in the world that are more difficult than to be close to someone who has mental illness, who doesn't believe they have mental illness and doesn't want help. And our systems, the social systems we have, are not well set up for that, right? I mean, we should be doing more active outreach and engagement and working with folks, but even when we do, there are limits, right? People can tell us they do not want to talk to us, and we can keep coming, and they can keep telling us they don't want to talk to us. And families can call us and say, do something, please, this is horrible. And there are times we have to say, we're not allowed to do anything more than we're doing. So there are those situations as well. So, I mean, I'm always interested in information that leads you to believe we're not doing enough of it, because that's, information I want to factor into our program development and our system development. So please keep bringing that forward. And then if there are ideas you have about resources we need to have that we don't have, send that information ahead as well.
Yeah, no, thank you. And I do know that there's lots of programs out there that are doing the work, and I very much respect and admire the work. I do think that there is a need for more, and there are some gaps that need to be filled, and I'd like to support. I don't have the answers, unfortunately. I have more questions. I think we all have more questions than answers at times, but I'm certainly here to advocate on that end, and we'll continue to bring it up. So thank you.
Great, thank you.
And Erica, just a minute, Peterson, I'll get you. But Erica, Chloe commented that Imani Dodd and Buckaloo could also support families, youth, and family adults. And she gave the name of Mariana Monreal as a community access navigator. So that's a source And I'm also thinking that the mobile support team does some of that, especially on initial calls. I'm also thinking that we should be carefully watching what is happening with Laura's Law, because I think that a lot of times families are stuck watching their loved one struggle, and there's no, they're just not to the point where law enforcement or anybody can do anything about it. So we should be closely watching that, because that's possibly another.
And if I may, Kathy, I also think that there's families who I've worked with that I know as well that are able to reach out for help because they can see that light, perhaps a bit of light at the end of the tunnel. There's those that you spoke of that are so consumed with the issue that they can't get out of those four walls. And so I feel for those families. I wonder what we could do for them. And I do think that the home visit component where it's culturally sound and sensitive and aware would be very helpful. Because yes, there are lots of folks. I mean, I have my brother who has schizophrenia, and to get to where we're at today has been very, very difficult. And it's been very isolating for my parents, as they are mostly comfortable in Spanish, and they don't really understand the system. And even though I'm one to be known to be well resourced, it's still been very difficult. So I feel for those who don't understand the system and know how to navigate. So just, always plugging that in, but very appreciative of all the resources that are out there. So thank you, Erica, for bringing up those resources.
Kathy, we have a hand. Sherry would like to talk.
Okay.
Can you hear me okay?
Yes.
Okay. I just want to add that as a family member with a client, I've been, over the many years we've been in this system, I have developed a relationship with the different case managers. They have done home visits from time to time to see Scott's situation, and that's been very, very helpful. I also have a relationship with him. So if your brother, I was passing this on to you personally, but if your brother is a client, maybe through you can help your parents develop a relationship. I know that right now, as Bill says, there's a tremendous amount of need out there and understaffed and heavy caseloads, but the services are there. We've also had groups within the behavioral health system. Sid ran too over the years. So I'm looking forward to the day we get back to that kind of a situation, because those were very good times. I'm happy to help you in any way. I do not speak Spanish, unfortunately, but I've been on this journey with my son in the system for, well, at least almost 20 years, I guess. He's been in care longer than that. But, again, I hope, looking forward to the day when we can get back to those times when case managers had the time to be able to be that support system for the family and the client. And it did happen, and it was good.
Thank you.
Thank you for that, Sherry.
Peterson.
I was just was making reference to the chat, because you told me that I was responsible, but you did it before me. That's what I was trying to do.
There's something else there. Did you see it?
Yeah.
She also said, this is Erica still, I think, that she said that SOS also supports families. So, yeah. So, okay. So, any other questions for Bill? Okay. I think that, Bill, I also wanted to let you know that I forget which meeting it was at, but Betsy and I are interested in looking at housing and the housing continuum. And in part in response to, the knowledge that I've already shared with you that there are very few beds in Sonoma County, especially for those on conservatorship. So we're going to hopefully investigate that. And I've asked you if you could help guide us in that.
Yeah, well, if you don't know them, I'll introduce you to Michael Gauss and his team at CDC, and they can describe to you what housing resources the county has.
Okay, and is there somebody working on housing within the behavioral health system? Is that them?
So we don't have a somebody. I mean, we are always working on that. We've partnered with a number of the local developers who have submitted No Place Like Home competitive bids. So there are, I think, 3 projects that have been green lighted to open housing over the next 2 to 5 years.
Okay. Well, I can get that information from you, but I just wanted to let you know that we were headed that direction.
Mm-hmm.
Okay, so if there's no other, general questions for Bill, we'll move on to
Kathy,
yes.
excuse me. I think Sherry had another comment.
Yeah, I did have another comment regarding the family interaction that Betsy proposed. Through all this pandemic, the one person that's been consistent in meeting with my son has been the Buckaloo person that works with him on keeping his sobriety. And she's really been fantastic. And she's been consistent and been there with him on a weekly telephone visit. So I don't, again, and not knowing if your brother is a client, but for other families that that do have, that are clients, there is that support as well outside, connected to the behavioral health through the mental health service contracts. And I just wanted also to point that out, that the contracts that we have with Buckaloo are absolutely incredible. And I really hope nothing ever happens to that connection, because they are fantastic for our clients, as is NAMI. And, all the support that we have out there from the Mental Health Service Act has been, I would say, life-saving over the years that this has come about. Thanks. That's it.
And Erica has a comment.
Hi guys, can you hear me?
Yes. Well, now you've disappeared, but we could.
Sorry. I just wanted to say that Umanadad, Mariana, and Nicole from Buckaloo are both bilingual and bicultural. And so both of them can serve any family member that has a youth and or adult loved one with a mental health challenge. And so I know that previously, I think part of it is COVID. Previously to COVID, a lot of them were working directly with the county, and they could, go out in teams even to support families like you're talking about. I think COVID's been sort of difficult for everyone, but those two definitely could be of support in the area that you're talking about. And they're working really closely with NAMI. I think I saw Mary Frances, but I know Mary Frances has some plans to also do some support in education groups, and talking to Buckaloo and Umanadad. So I think there's some real work that's being done to try to address with the community partnerships that exist.
Thank you, Erica. I think Mary Frances had to leave. So, oh, there she is again.
Hi, thank you. I will just say that we are opening up a family support group for Spanish speakers on June 21st. And the group will be co-led by Mariana from Humanidad, whom we're talking about, and a former NAMI employee who's fully bilingual. we're doing that for the summer. And we're starting there with hopes that from out of that support group, we will be able to develop a class participant list for our family to family education program in Spanish. We're working on creating awareness of that within the Latinx community. We'll be doing that shortly. Thank you.
Thank you for that. And I know you and I will be working together to promote or enhance here, or at least bring it here to Sonoma Valley, or perhaps how to bring in families from Sonoma Valley to the program, which I really appreciate because I think there is a huge need. I think I just want to say, you know, my family is not part of the county, so they're not clients of the county, and that's a whole different obstacle, I feel, because having them go through the county is something that I've been working with. I haven't been as successful as I would like to be, and like I said, I feel like I'm well versed in a lot of the in navigating resources here and understanding the system a little bit more clearer. So I just know that there's still families out there that need to be reached. That's no one's fault, really. I think it's just the way that the system is set up. But I would like to work closely with all of you who are working with our communities to lessen that gap and to build more awareness and to support the families who are greatly in need. So again, thank you, and I am here to support any and all of that work.
Betsy, I think you're the right person in the right place at the right time. Okay, so if there are no more questions for Bill, I'm going to skip inviting the Board of Supervisors representatives that item. I know that Linda's our representative in West County, and the budget hearing is apparently on the same day as our meeting for West County. So I'll invite her, but I'm not holding out a whole lot of hope. So I want to move on to the other reports, and I know that Bob Hale, I know that you are working with the jail committee and with the visits, the site visits. You're muted.
I'll comment on the site visits. So far, last year, before the pandemic, we conducted a site visit to the CSU in Parker Hill Place. Kathy, did you participate in any
Of the site visits?
Yeah, didn't we do?
Yes. I participated in the Progress Foundation one where we got the tour with the cell phone.
Yeah, Progress Sonoma. Yes, that was.
Progress Sonoma, and I also participated in CSU.
Yes. So Progress Sonoma was quite imaginative.
It was.
We were like walking through the building. Someone was zooming. And we could see the rooms. We could see the outside. We could see their bulletin board. We could see their kitchen. We could see where they leave food. It was really quite impressive.
Open drawers for us.
Yes, showed where they stored stuff. It was really quite impressive. And also, we asked them, in our list, quite a few questions. And the responses were quite accurate or informative. And I was very impressed with the whole Progress Foundation. The other one we visited was Buckaloo Foundation, Buckaloo. And in particular, Manor House, McBride, and Petaluma Apartments. That wasn't a virtual tour, but the CEO presented incredible slideshow that showed, it was almost like a walkthrough, as he showed pictures of all the inside, outside of the buildings, where the smoking areas are, where the outside facilities, what they're like and what they do, break rooms, and it was quite impressive in their response to questions too. So currently, I have a call out or email out to look at community support network, CSN. We haven't toured any, site visited any of those facilities. And I was asking, it's a woman named Thai Gallo about Hope House and Brown Street. Hope House is a 12-bed men's board and care, and Brown Street is a 15-bed home for women. And those are the two facilities we'd like to visit. And then I have an email out to Sid McCauley, and then thanks to Tori. Hope I'm not driving you crazy with all my old changes, but you made changes to the screening document for behavioral health programs, not contracted agency, because there's a lot of questions on the form that aren't relevant for a behavioral unit operated by the county. And so facilities, I like, and actually I asked Bill's comment on this, the access team, whole person care, older adult collaborative care, and mobile support team. Those are the four tentatively was scheduled. Do you think those are okay, Bill, or are those fine? Okay. So I'll wait till I hear from Sid to find out who is the contact person. Looking at the list of programs, one area which we have not focused on are the peer-run programs in West County community. And for instance, Petaluma Peer Recovery Center, the Wellness and Advocacy, Interlink Self-Help Center, Russian River Empowerment Center. Those are some of the sites we haven't visited. But as an agency, we haven't visited the West Community Program, West County Community Services Programs. Now, the ones I mentioned, are there any that you feel in particular that we should visit? Those are the Peer
So-
Center.
I think that that this next board meeting, I think that that's going to be part of their focus, since West County Community Services is the agency that's now in charge of the peer centers, and Christy Davila is going to be the main presenter. So I think we'll have quite a bit of information from her on the peer centers, and she may have, it might be good to ask her specifically which ones we should visit. And that'll be, coming up real shortly here.
You have her email address, Kathy?
I will send it to you.
That'd be great. And I can maybe contact her even before to tell her what we're planning on doing.
Okay.
I've been very impressed though, the agencies we've visited and the CSU, the enthusiasm of the staff and the caring attitude. It's hard to be critical and try and be objective, but it's very difficult to find that much criticism of the facilities, but doing our best to be objective. The one problem we're running into is adult consumer. We want to have one or two adult consumers interviewed, and we have a forum for them. And the Progress Sonoma staff person I've been in contact with, and she may have 2 or 3 consumers complete the form, or maybe more, and then being able to interview 1 or 2, either by Skype or by phone, to get some feedback concerning consumers' perspective of the program, which I think would be helpful. I mean, because that's what the whole purpose is, to help them. So that's one missing link. So it's been an interesting opportunity to learn more about the community programs that are being supported by the county, and just seeing them either by video or by a slide presentation has been helpful. So I think that using the Zoom link has actually been not a bad way to do it. And I don't think we've lost a great deal, although it's always good to see the place, and gives you a chance when you visit to interview an adult our child consumer. So that's all I have. It's been a good experience.
Okay, and you were also involved with the
On the jail.
jail.
Yeah, it's been difficult to get a response from them on various questions. They're not exactly the most communicative group. So we're at a kind of impasse. Carol has been the key person who's contacted them, but she's emailed them several times, not heard from them. So just waiting to get a response. Actually, just backing up with the visits, people who have volunteered to conduct future visits, there's at least 2 members should be on the site visit. Patricia Gray, Betsy Chavez, thanks Betsy, Carol West, and I have Bob Cobb's name down. Is that correct, Bob? But I'll be contacting you once I get the okay and contact from the contact person for the facility. Then I'll go down and contact you all and try and arrange a time. It just takes, oh, Michael.
Yeah, I had been interested in the mobile support team. I thought that sounded really interesting.
Okay, done. So when I contact them, I'll make sure that you're the person. They'll be on it.
Great, that's awesome.
Thanks, Michael.
Mm-hmm.
I have a question for you, Bob.
Yeah.
Has there been generally an overall staff turnover at the jail with the people that you had contact with? Could that explain some of their change of their receptivity?
There's been some staff changes in the sheriff's organizational chart of people, and there's been change in some of the clinical staff. But it was kind of challenging before that, to tell you the truth. It's just like a void. But we'll keep plugging along. But I don't think the staff changes made that much difference.
Well, you've made inroads into communicating with them way more than we've had ever since I've been on the board. So you've made a lot of progress, even if you feel you're at an impasse at this point.
Well, I made a nice presentation at the board meeting. We want to follow that up with a new jail inpatient unit, but and we've been in contact with the person who's changed it. I think they're talking about 2023, 2024. But anyway, we're plugging along.
That's that would be when they are ready to do it. That would make a good presentation on the
Yes,
new.
that's,
So when
yeah, the
you
person in charge of the jail is what, at least the design elements, is who we wanted to present because we thought that'd be helpful.
yeah, so when you feel like they are ready to do something like that, let us know.
Okay. Will
Okay.
do.
So okay, I think we're on item 8. Acknowledging the behavioral health staff. And I know that last month we acknowledged NAMI, which is a group. So it's probably technically time to do an individual. But I'm also thinking that since West County Community Services is doing the peer centers, is running the peer centers at this point, that it might be a good time to acknowledge them, or the peers, either the peer centers as a group or West County, unless somebody has an individual that you really want to put forward.
Maybe it's a good idea, Kathy, to simply not have a rule of alternating, but whomever is on the horizon who we have current awareness of their contributions, whether it be an agency or an individual, we honor them that month and not have any particular rules about it, as long as we do honor some individuals and some agencies over the course of a year.
That sounds good to me.
I'm wondering,
Yes.
perhaps, we've mentioned a lot of, the Buckaloo as well as the Humanidad agencies. I wonder if either one of them we can honor. I know that we've honored NAMI and some other really key agencies, but I'm maybe just a thought.
Both the Progress Foundation, we were very impressed with their program, and also the Buckaloo programs. I'm not sure. Either one, in my opinion, was done a great job. Progress Foundation was very specific on their programs, but we could, but I mean, I'll defer to the group. But the Buckaloo running the peer programs, or correction, West Community, we haven't had a chance to interview any of the people, but we did the Buckaloo and Progress Foundation. I can't differentiate because they run different programs, but both were impressive. That's it.
It sounds like this might be a time to begin creating a list. And the good thing about that is that we have so many agencies out there that we feel very positively about, and they're vying for a position who's going to be on this month's honor roll.
Yeah, it's nice to have so many choices. So I did write down everything that people mentioned. So we certainly have places to honor. Marianne?
Thank you. I think it wouldn't hurt to honor West County Community Services and the peer centers in the same meeting, since West County is supporting them. That's a big chunk. And over time, I've had the privilege to be invited, the board has been invited as guests to the peer centers. And Carol West at the Petaluma one has been an extraordinary hostess and runs the peer center down there. And you just have to try to imagine what it must be like to not have any place to go, but you can go there. And it's not to be too punny about it, an island of sanity, peaceful, clean, just a lot of amenities that people don't get when they're bouncing around on the street or don't have a comfortable place where they can be. It's a wonderful resource, all of them.
So can we start with West County Community Services and the peer centers?
We could do both together, couldn't we?
I think we can. I think there. I think that what I will do is I'll plan on making West County Community Services a certificate that's general, because they have a lot of services that are beyond the peer centers. They've got the senior, they've got a program through the county. I'm pretty sure that through MHSA for seniors who are isolated, and they've got a lot of programs. So West County Community Services I'll do separately from the peer centers, and then I'll do a certificate that each center can display. So if that sounds good, I'll do that this month, and then we can decide. We've got 3 more that we could choose from.
Thank you.
Carrie has a
Kathy.
comment.
Yes, who had a comment?
I do, Sherry.
Sherry, okay.
Yeah, I'm not a board member anymore, but I support the West County Community Services and the peer centers, because at this particular time, they've throughout this last year of COVID, they've found a way to stay engaged with clients and help them, you know, extenuating circumstances for sure, that they have worked with the not just the clients, but the community that needed them. And so I think that it's really appropriate to honor them at this time. But I would also like to suggest that the next one, either a person or agency, be one of the ones that serve the Latinx community, because they're we've you know, Kathy, you know, you and I have been here for a long time. We've tried so many years to be able to engage with that community, and we finally have some great inroads. And I think that we want to, if we can reach out and honor one or some of them at this time, that'll just help them keep on keeping on.
Okay, well, Betsy mentioned Imani Dodd, so maybe that's a good one to consider for the following month. And I'm not going to be there June 13th, July 13th, I mean. So Peterson, you and I can talk, and possibly somebody else wants to do the honoring at that meeting. It's usually just a short time, so we can talk about that in July.
No problem.
I was thinking that, correct me if I'm wrong, Betsy, did you indicate also Buckaloo?
Yes. Yeah, because they were, you know, both noted today at various times. So.
Well, maybe this is not necessarily setting a precedent, but we're combining two, not exactly two agencies, but this coming month, but they are in a sense peer support groups, and as well as West County. So maybe it gives us an opportunity to think about combining, honoring agencies that work with the same populations or have similar programs or work together. In this case, possibly Buckaloo and Umanadad.
Okay, well, I'll put them on our list for July, and we can decide what we're going to do for them then. Okay, but this month, it's going to be West County Community Services and the peer centers. We talked a little bit about the scheduling of special presentations. We're not doing anything until September. So we have time to, you know, think about what we could do in September. I think that Carol was looking forward to the having the group talk about reentry after incarceration. So perhaps we could just put that on for September, and then we will not have so much thinking to do in July. So I'm going to put that down as a maybe for September. I want to acknowledge, I'm going to put this into my report. I want to acknowledge that we did come up with some a statement to replace the statement that I make at the beginning of the mental health board meetings at our retreat. Tori, do you have that? I sent you an email this morning. Bob had edited it. Could you put that up, please?
Yes, ma'am, I will.
Thank you, ma'am. So Bob Hale did a little bit of editing. I want you to look this over and see if you think that we've captured it.
I added a fifth bullet on families because I think that was buried, didn't come out that much. So there used to be 4, now there's 5.
I would say we're the Behavioral Health Services Division, the first line in the paragraph after the bullet points.
Behavioral health services instead of mental health services.
No, behavioral health.
Behavioral Health Division.
Rather than mental health board, behavioral health division.
This all of those attached.
Okay. Behavioral health. Perfect.
And probably in the next to last line where it says with mental health services, and Bill, correct me, it should probably be behavioral health services.
I think either is fine. I mean, Behavioral Health Services is more accurate. Because you're still a mental health board, you may want to make the distinction. I think that's really your call.
Yeah, I think that we need to remain mental health board, but behavioral health services is fine in there.
So I approve of what we came up with and how it looks right now. Is this a portion of what you will be reading or whomever will be reading at the beginning of a meeting, or is this a document that will be available for people to look at?
It's certainly what I'll be reading. It could easily become a document. It could be posted, I think, on the county page somewhere. As far as having an actual physical document, we're not meeting in person, so I'm not sure where it would be, how that would be, available to people.
Right. I guess part of my question is this everything you might read at the beginning of a meeting?
Yes, it's to replace all of those, I don't know, it was long before. And so we shortened it.
Right. My concern is I'm not seeing anything here that defines us as being an advisory board advisory to the Board of Supervisors.
Oh, that's true. That
Which is a key role that we have.
so maybe that's a statement that just goes at the beginning of it, that the mental health board is an advisory board.
Well, in that paragraph down where we say the Sonoma County Mental Health Board collaborates with the Behavioral Health Division, can you insert, in other words, providing advice, advises the Behavioral Health Division. Collaborate.
It advises, but what Bob Cobb, I think, is saying is that we're advisory to the Board of Supervisors.
Okay.
Right,
Yeah.
and that's a key role that we have.
Which was part of the original one, so we should at least have it before the statement.
I think that's a good idea.
Okay, there we go.
Yeah.
So maybe the mental health board, who we are, just insert that paragraph before we support.
Yeah.
Anything.
Yeah.
Does that make sense?
Yeah, I think that takes care of my concern.
Yeah, and without adding a whole lot of length, it
Mhm.
adds that thought.
Yeah.
Thank you, Tori.
Yes, she's a magician. Right in front of us. Okay, does this look acceptable? Anybody feel that it needs more editing besides what Tori's doing right now?
One obsessional comment, 3 lines from the bottom where you say to positively influence, the split infinitive, you want to say to influence positively. Not to be an English major.
Yeah.
I'm sorry, how did you want to change that, Bob?
Or just say
Influence positively.
positive.
One more time.
To influence positively, just move positively after influence.
So we strive to
Just-
influence.
Just swap the words, I guess.
Mhm.
Yeah, that's it.
Okay. All right.
We eliminated the blue line too.
Okay. Any other comments on it? Okay, this is then going to become the first part of the chair's cheat sheet. And I will definitely read it at the beginning of each meeting. And I don't know, I think that we can decide at our next executive meeting where else to put this, but be thinking about, it would make sense to have it available when we were in person, just on a card or something that people could pick up. But if we're not in person, where would we put it? So be thinking about that, and we'll address that at our next meeting.
Kathy, do you think that this would be too long for you to read at the beginning of the meeting? The reason I'm asking is, what if we had 2 board members, split the thing up and read part of it each or something like that? Would that continue, would that invite the attention of the audience a little more or not?
I'm happy to have somebody else read part of it. So, we could have 3 people read it. So, are you volunteering to read part of it, Bob?
Sure.
Okay. Do you want to read the we support part? The bullets?
Yeah, that's fine. Yeah, maybe 3 people. Well, either, either come back to you at the end before you start the meeting, or however. I'm happy to do the central part if you want. I just need to make sure I've got a copy of it available at the meeting.
Okay. Would somebody else like to read the last paragraph? Mary Ann's shaking her head. Okay.
can.
Betsy, put her hand up before you, Peterson.
That's fine. I was just,
Yeah, but I saw her take it down really quickly too.
Mine's still off.
Okay, so I don't know which one of you. I'm not gonna.
No, I think I did it. I was just playing and seeing the names.
Okay, so let's have. You're running the meeting in July, Peterson. So we'll let Betsy do this for now.
Sure.
Okay. That is done. Okay, and I'm looking back. Anybody have anything else that we should be putting on the agenda?
Can we come back? Maybe this is the time or maybe not. The question that I asked at the beginning about our funds in our treasury. I was wondering, are there, and maybe if Sherry's still around, she might be able to answer. Do we have memberships in any organizations such as where is it? CALBHB, and where we owe dues and so on? And maybe if so, we could prepay some of that.
I am not sure. Does the county pay for that, Bill? The COM board? You're muted.
I don't know what our history has been, but in general, you should have a budget from the division that would support such a thing. And if you didn't, I'd entertain a request for funds.
I think it was paid this year, and I don't think we paid it. Do you have a list?
Are you talking about the our dues?
Yes.
Oh, no, we pay that.
So
I thought you were talking about participation in the COM board meetings.
no, in the past, we've had a representative. Sherry was our representative, and she attended, and we did pay for travel expenses out of these funds. And the reason that we have so much money left is that we didn't have any need for travel this year.
Right.
Meaning that we will be traveling again at some point. And I know that Sherry was our COM board representative, and I don't think that we have anybody assigned to that duty at the moment.
Sherry has her hand up right now.
Yeah, just in terms of the dues, that's something separate, as you're saying, that's something separate from, but it is something that we're responsible to pay every year to keep a part of that body. Every county is. And they need those funds to be able to keep their office in Sacramento and keep working with the legislators. So, I think it's important that we stay connected to that body, or that, sorry, I'm not on the board anymore, that the board stays connected. The local Sonoma County Mental Health Board stays connected to the COM board.
Right. And
by paying dues.
Yeah, as Bill said, I think that the county itself pays our dues, but I'm looking at the time, it's 12. We need to be looking toward having somebody who's willing to make a focus of paying attention to what the COM board is doing. So Sherry was that person, and we'll need to assign a new person, but we can do that at our next meeting.
Really quickly, Kathy, I'd like to just say, I really invite everybody to check in on the website, because there's a wealth of information there, and it's important to, our body is really important to them to work with the legislators to get things done.
Yeah.
As with the division, the behavioral health division directors as well. That body, the COM board body are important to work together with the,
And there is a wealth of information.
yeah,
And I have been in contact with them and attended, both Carol and I have attended several of their presentations, and they're good.
yeah.
Yeah. So anyway, it is noon, and I can't ever remember if I need a motion to adjourn. We already had one way back at the very beginning of the meeting, but Bob, you want to repeat yourself? Bob Cobb
I move that the meeting be adjourned.
and Bob Hales seconds it. Peterson thirds it. Okay, meeting adjourned. Thanks, everybody.
Thank you.
Thank you, everyone.